All right, well, it's 12:01, so we will get started for respect of everyone's time. So I'd like to just welcome everybody to, I believe, the last educational session of our Tools for Resilience series. We appreciate you joining us this afternoon. Today, you're going to have four presenters. Myself, Andrew Waite. I'm from Northern Lakes. Sarah Burkett, who's also from Northern Lakes and an RN care manager for our chat program. Alyssa Colley. All right, I got it right. Who's also an RN care manager from North Country in their behavioral health home program called Hatch. And Chandra Harwood, who is the director of the program over there at North Country. So we're going to be presenting today on where to go for care by myself. Sarah will be talking a little bit about type 2 diabetes. Alyssa will talk about water and some movement, little things you can do for wellness. And then Chandra will be talking about TikTok, I think, about ticks and awareness in the environment. We'll kind of go through our presentations. You can put questions in the chat or raise your hand, and we'll take questions. We will have time at the end of all of us going to answer any questions that you might have regarding any of the topics or other burning topics you have about health. So to get started, I will start off. If I can. All right, so I'm going to do where to go for care. So we're going to look at when you go to the emergency room, urgent care, or your primary care office. So the importance of knowing where to go. Time is precious for us. So, remember emergency rooms triage patients, meaning that you could wait there for hours to be seen if you have a minor illness, as they will always take somebody that is in a more serious condition first. So you could wait there. Knowing the best place to go for care can save a lot of time and frustration. If you show up at your primary care, your urgent care, and you have a life-threatening situation, they're going to have to get EMS, take you to the ER, and vital time could be lost. Your doctor knows you best. And then it's significantly cheaper to go to your PCP or urgent care than it is to go to the ER. So if you have out-of-pocket costs with your insurance plan, knowing where to get the care, the appropriate care is best. So we'll look at what are some things that we go to our doctor's office for, our primary care, annual physicals, sport physicals, yearly screenings for preventative medicine, prescription refills, referrals to other medical providers. So if you feel like you need to see a specialist, you would go through your primary care, pregnancy test, aches and pains, cold and flu symptoms, COVID symptoms. Those are all things to call your primary care office or go set up an appointment with them. Also, another thing to keep in mind is you can always call your primary care office first or your health home first to run by what's going on, and they will give you direction as to the best place to go to get care. And a lot of times, sometimes they can handle stuff over the phone. If it's a simple thing, they might be able to call you in a prescription or order a test or something for you to do outpatient and then see you the next day. So keeping that in mind is important. Urgent care. So these are not life-threatening, but need kind of, attention now. Not going to be able to wait for the next day. So minor fractures, sprains, minor burns. So if the burn is severe enough, you do need to go to the ER. So minor burns or cuts, like eye infections, if UTIs, cold and flu symptoms, persistent diarrhea, things that you might go to the urgent care if your primary care provider is closed for a while, like if it's a holiday weekend. and you can't get a hold of your primary care provider, but you're gotten sick, like that's a good use to go to the urgent care. Because if you come into the ER with an urgent care need, you're likely to sit there for hours. And then things that you go directly to the hospital or call EMS 911 are life-threatening situations. So if you're chest pain, difficulty breathing, a change in your speech or facial paralysis or other stroke symptoms, seizures if you don't have a known seizure disorder, choking, poisoning stuff if you've ingested something that is poisonous, bleeding that won't stop, and then sudden severe pain are another thing for life. Again, go directly to the hospital or call EMS. And then I wanted to touch a little bit about oral health and then go into places where we can get dental care, because that's another thing that comes up a lot. So oral health, is important. Did you know that bacteria in dental plaque can affect other parts of your body, such as your heart and lungs? It can contribute to heart disease. It can increase your risk to certain types of cancer, stroke. And so if you have diabetes too, that Sarah will be talking a little bit about, it's important to maintain good oral hygiene to prevent periodontal disease and other health complications from developing due to the type 2 diabetes. And then poor oral hygiene in gum disease has been shown to increase low birth weight newborns and preterm births. So women that are pregnant or wanting to get pregnant should definitely follow up with their dentist and make sure that they're having good oral hygiene and getting health checked out. Oops. So where do you go if you're on Medicaid or no insurance? This question comes up a lot for us. So in the area, we have dental clinics north. They're usually based in a health department, local health department. They cover Traverse City, Mansalona, East Jordan, all the way to Gaylord, Harbor Springs, Charlevoix, Alpena, and Beaver Island. So, there's a number and a link. All of this will be posted online too, so that you can reference back. And then my community dental centers, they kind of service the more southern part of our region. They have locations in Roscommon, Mount Pleasant, Manistee, and Cadillac. They also have a bunch of places downstate outside of our catchment area of both North Country and Northern Lakes. And then in Traverse City and Benzonia and Shelby, Northwest Michigan Health Services, which is a federally qualified health center. They have some dental services that they also offer. And so their contact stuff is there. So it's important to have both a health home, like a medical home, like a primary care physician, and also to have a dental home that you can. And then I'll talk a little bit about when you go to the dentist versus when you should, have an urgent follow-up or go to the ER for dental emergencies. So you should follow up with your dental home if it's, not urgent. So like you have a toothache, maybe an abscess tooth or a lost filling, you cracked one of your crowns, lost or knocked out a tooth, filling or crown, you've had long-term aching pain in your tooth, or it's become sensitive to heat, cold, or pressure. Those are times to follow up with your dental home. And then urgent care, you should go if you have a major toothache, you have minor mouth swelling or bleeding or sores in your mouth, or you have something like a foreign body stuck in your tooth or your gums that you can't get out. And then things you should go to the ER for, so directly go to the hospital, is severe trauma to the face or jaw, severe mouth pain, swelling, and bleeding. Anytime you have numbness or weakness that comes out of nowhere, Severe allergic reactions, you can't move your face, or sudden head or neck impact. So if you were in a car accident or something like that and you had trauma to your head or neck, you should go. So kind of went through that fast, but that ends. So I just kind of have, we're going to pass it off to Sarah to go over type 2 diabetes. I'm going to stop sharing, and that should let you share, Sarah.
Can you see it?
Yes, we can.
Okay. Oh yes, I'm sharing on diabetes today. Oh, my notes aren't here though. Well, I had notes that aren't showing up. Awesome. Well, we'll just wing it. So, what exactly is type 2 diabetes? It's a chronic health condition in which the body is unable to properly process sugars. This can be due to lack of insulin production or poor insulin response. So risk factors for diabetes are obesity, lack of physical activity, your age, if you have high blood pressure or cholesterol, if you have a history of heart disease, gestational diabetes, you're at increased risk, or polycystic ovary syndrome. A family history of diabetes greatly increases that risk, and also your ethnicity. So African Americans are at greater risk, the Latino population, American Indian, Asian American, and Pacific Islander. So what are the symptoms of diabetes? Increased thirst, frequent urination, increased hunger, unintended weight loss, some fatigue, blurred vision, slow healing sores, frequent infection, numbness or tingling in the hands or feet, and areas of darkened skin, usually around the armpits and neck. So how is diabetes diagnosed? Usually it's with an A1C level. So a normal level would be under 5.7. Pre-diabetic is 5.7 to 6.4. And considered diabetes is above 6.5. Treatment, diabetes is usually treated with the dietary modifications are usually one of the first places, especially if you're pre-diabetic. They'll really encourage monitoring your carbohydrate intake, increasing your physical activity. As you're diabetic, you'll want to check your blood sugars regularly. Depending on, what your hemoglobin A1C is, your doctor will recommend sometimes it'll be 4 times a day, with each meal and at night. Sometimes they'll recommend just morning and evening. So treatment with medications, there's both oral and injections, metformin, glucophage, those types of things. Insulin therapy would be more like a Lantus, which is a long-acting, or a sliding scale like a Novolog that you take 3 times a day, usually with meals. Complications of diabetes. Diabetic neuropathy is a type of nerve damage that can occur due to elevated blood glucose. Diabetic neuropathy most often damages nerves of the legs and feet. And then foot damage can happen due to the nerve damage and blood vessels related to higher blood sugars. Neuropathy, more about that, numbness and tingling, pain or loss of feeling in the feet. So with diabetes, it's important to do regular foot checks. You want to obviously take off your shoes and socks, look in between the toes, the bottom of the foot. It's important to inspect often, sometimes daily. Heart disease is an increased risk due to the diabetes because of the nerve and blood vessel damage. You're 2 to 3 times more likely to develop heart disease if you're diabetic. Eye damage associated with diabetes. It's often encouraged that you have at least a yearly eye exam so that can be monitored. And then kidney disease. A lot of diabetics with uncontrolled diabetes will often end up in kidney failure, and that can lead to dialysis. And I really flew through that, so I apologize, but no. I'm just wondering, how do I stop sharing now? Oh, here we go. Okay, I'm stopping sharing. Thank you, guys.
All right, and I will share my screen now. Can everybody see that?
Yes.
Okay, thanks. So good afternoon. My name is Alyssa, Nurse Care Manager at North Country CMH, like Andrew had said. And welcome to the second half of our presentations. As we get started, I'd like for you all to first join me in taking a nice deep breath. So if everyone can breathe deep in through your nose and blow it out through your mouth. Again. And if you can interlace your fingers and reach, stretching up to the ceiling or wherever you're at, and sway side to side, nice big stretch. You can lower your arms and roll your head, stretching out that neck. All right. Well, thank you for joining me in that little exercise. So I'll be discussing and sharing the benefits of walking, how to get started, along with the benefits of water and some tips to drinking more water. So to start, the benefits of walking for 30 minutes a day include decreasing your resting heart rate, lowering your blood pressure, and LDL, your bad cholesterol, and strengthening your heart. This reduces the risk of heart disease. Walking benefits your mood by releasing your body's endorphins, which in turn reduces stress. Walking is also one of the best exercises for losing weight. It's relatively easy to do, easy on the joints, it's free, and you have to do it every day anyway. Research has shown that walking 2 to 5 minutes after a meal can lower your blood sugar. And then walking improves your immune system by increasing your blood flow, reducing stress, and strengthening your body's antibodies. You're keeping your immune system strong for whenever it's needed to fight any virus or bacteria. And as you walk, you lubricate and strengthen your muscles and increase blood flow to your cartilage, protecting your joints. Walking can reduce cravings for sugary snacks. And research has shown that 2.5 to 5 hours of moderate intensity exercise per week, which includes walking, can help reduce the risk of certain cancers. And then also improves sleep. It's recommended we get between 7 to 9 hours of sleep a night, and walking can improve the quality of sleep you get each night. So some tips on getting started. First, consult with your doctor if you have any musculoskeletal injuries, any torn ligaments, and or cardiac problems. Start out slow. Don't push yourself too hard. Track your steps. You can use an app on your phone that has a pedometer, or there's a million different kinds of watches out there that can track your steps as well. Don't be too hard on yourself. Oh, and then find a walking buddy. This can be a friend, a neighbor, your kids, your dog, your spouse. And then adding your walk on your calendar could be helpful if you're one of those people that need to schedule your exercise or your walking. And then parking further away from an entrance or taking the stairs instead of an elevator is a good starting point as well. So this I just thought was a good visual on the benefits of physical activity for children. Some benefits I thought were good to touch on are the academic performance, improves attention and memory for kids, strengthens bones, and then the long-term health benefits for kids is reducing the risk of several chronic diseases, including type 2 diabetes and obesity. And then again, for adults, I've already mentioned most of these benefits. However, this is a good visual for the immediate and long-term benefits. You can see there improves sleep as an immediate response, reduces anxiety, blood pressure, healthy weight, balance and coordination for those long-term benefits. And then just remember, small progress is still progress. And then on to the benefits of drinking water. Getting enough water every day is important for your health. Drinking water can prevent dehydration, a condition that can cause unclear thinking, result in mood changes, can cause your body to overheat, and lead to constipation and kidney stones. Water helps your body keep a normal temperature, lubricating and cushioning joints, protecting your spinal cord and other sensitive tissues, and then getting rid of waste through urination, perspiration, and bowel movements. Your body requires more water when you're in hot climates or are more physically active, have a fever, diarrhea, or vomiting. Some tips on drinking more water is carrying a water bottle with you throughout the day and refilling it throughout the day as well. Choosing water over sugary drinks. Opt for water when eating out. Serve water during meals. And then if you're one of those people that do not like the taste of water, you can add a lemon or a lime wedge, berries or cucumber to your water, and that can help improve the taste. And that wraps up my presentation. I feel like I sped through that as well. So thank you.
All right, looks like I'm next. Let me get this started. Can you guys see my screen? Okay. All right, hello, I'm Chanda. As Andrew said, I'm the Director of Health Services for North Country. And as you can see from the picture, we're going to talk ticks. With warm weather upon us and folks heading outside, this is the perfect opportunity for a tick talk. I know we're all really aware of the importance of sun protection and mosquito protection. We also need to protect ourselves and our furry friends against these little critters. Ticks may seem like innocent, pesky little insects, but they can carry diseases that may lead to serious health concerns. They're also a challenge because they're so small that you may not even feel them or even know that you've been bitten until you find one. And so I've included some real cringe-worthy examples of that. If you look here, you can see that a tick has made its home in a child's ear. This picture right here is another child with a tick that's embedded in the back of the ear. And then down here, if you look, you'll see these are tweezers, and this is actually a photo of a tick that's being removed from inside the ear canal. I actually sat in on a case once with an elderly man who came into the office because he had a red rash around his belly button. And it looked like a giant red bullseye. Imagine his surprise when the doctor plucked a tick out. He didn't even know it was there. So they really can hide out and hang on undetected. See, we've definitely seen an uptick in the prevalence of ticks across our state, due in part to climate change. Warmer winters have resulted in more active ticks, potentially extending the typical April to September tick season through some of the winter because ticks can be active anytime the temperature is above 40 degrees. In 2021, there were 878 reported cases of Lyme disease in Michigan. Lyme disease is carried by the the deer tick. And this was nearly doubling the 451 cases reported in 2020. So we're definitely seeing an uptick here in Michigan. Some of the common ticks in Michigan, I've included a picture here of a bunch of them. We've got the American dog tick, the black-legged tick, Lone Star tick, woodchuck tick, and the brown dog tick. Those are the most common, but there's many tick species here in Michigan, and some of their nicknames actually correspond with the host or environment that they're primarily associated with. A little bit of facts about ticks. They can live up to 3 years, and if a tick attaches and is left undisturbed, it can remain on its host for 3 to 10 days, depending on the life cycle that the tick is in. And once the tick is engorged with blood, it will fall off of its host and either mate, lay eggs, look for another host, or die. You can see over here, I've included a picture of a normal tick or what it looks like once it's engorged with blood. A common myth is that ticks live in trees. They don't. They prefer to be on the ground where it's humid and where their hosts live, like rodents, deer, and us, people. Most ticks are just a nuisance, but the black-legged tick is also called the deer tick, mainly because it likes to live on deer. They're the ones that carry the bacteria that causes Lyme disease, and we're going to talk more about that. I included this because it gives a really good picture of the Lyme disease risk in our state. If you notice the real dark red areas, those are the areas with a known risk for Lyme disease. So the deer ticks are present and Lyme disease have been found in those areas. And then you'll see the lighter red color areas. Those are adjacent to the bright red areas, and that's counties or areas that have a potential risk. And then in the middle, the white areas, it's a lower risk, but as you notice, the ticks are kind of migrating to the middle of our state. So ticks can be vectors for a variety of diseases, from Lyme disease, Rocky Mountain spotted fever, and encephalitis. Tick-borne diseases begin often with flu-like symptoms, and they are treatable with antibiotics for the most part. People and pets treated in the early stages of these diseases usually recover rapidly and completely. The antibiotic doxycycline is the most effective treatment of Lyme disease. Lyme disease is carried by the deer tick, as I mentioned, and the good thing is that the tick must be attached for 36 to 48 hours or more for the disease to be transmitted. So avoiding tick bites and prompt removal are key to infection prevention. It's important to note also that symptoms of Lyme disease may not present for 3 to 30 days after being bitten. And the bullseye pattern showed here in example A, that doesn't always present. It can present just as a blotchy rash here, and I included some pictures of that. We'll talk a little bit about pet safety. Ticks, they don't normally come indoors unless they're carried inside by us or our pets. So creating a tick-safe zone to reduce ticks in the yard is really important. And we could do that just by, pretty much yard maintenance, removing leaf litter, using pesticides on your lawn, creating a barrier. That's also something that can help a lot. You can use mulch or gravel to kind of create a barrier between your home and the woods for those of us that live in wooded areas. And a fence is a good idea to discourage wild animals because they will bring the ticks with them. And for our pets, using flea and tick collars are a good idea. And also they have ultrasonic tick repellers that they're kind of, they're made for the pet to wear on like their collar, almost like a keychain, and they emit ultrasonic that repels teas and flicks. So or teas and fleas and ticks. So I thought that was pretty cool. So this slide is just the common places where you might want to check your pet for ticks. Ticks are drawn to dark, moist areas on the body, so particularly under the collar, ears, feet, that's closest to the ground, and in the groin, anywhere that's warm, dark, and moist, that's where they're going to migrate to. This picture here is a tick that's kind of making its home right there in the gum line. And then I included this picture to show kind of what the ticks look like when they're attached and engorged on your pet. So don't get ticked. This is a slide here about checking for ticks and how we can prevent ticks from being on our person. Showering may help wash off the unattached ticks, and it's a good opportunity to do a tick check. Another thing that's good is to tumble dry your clothes in the dryer on high heat for about 10 minutes to kill ticks that you might have brought in on your clothes. Ticks don't like the heat. So when you do the tick checks on your person, it's kind of the same as where they like to hang out on our pets, kind of those same areas. Another thing to note is the CDC recommends using a repellent with DEET as the most effective deterrent. So a spray with DEET is a good idea because DEET repels ticks. And also permethrin can immobilize them on contact. And permethrin is something that you might want to pre-treat your clothing and your gear with. You can spray your clothes, your shoes, your gear before you're going to be outside, like if you're hiking or you're going to go out in an area that you know that the ticks are going to be present in. I found a tick, now what? So I included this slide. Tweezers work great. That's usually what people use, but there are other tick removers that you can buy that are out on the market that are pretty handy. This one, I included a picture and it kind of shows how it kind of scoops up that tick. Those are really good for animals that have a lot of hair. And then this one, it looks like a little key and it's a tick remover. And I really like this one because if you notice, you can attach this to your keychain. So if you are outside, not all of us carry tweezers around. This is a real handy little tool. You don't want to pull them off with your fingers, and we'll talk more about that. So this is about tick removal. And I included this picture right here because it's important to note that when a tick attaches, they almost embed their mouths into the skin. And this is a really good picture of that. And that's why removing ticks the right way is really important. What you want to do is locate the head of the tick and grasp it as close to the skin as possible with your tweezers or your tool and just gently squeeze. Don't grab the tick's body, as this can increase the chance of injecting the tick's blood into your skin. And you want to pull outward in a straight motion until the head comes out of the skin. Don't twist or wiggle the tick or flick it, as that could tear the head off and leave it in the skin, as you can see in this picture here. Once removed, you can clean the site with soap and water. The CDC warns against using bare hands or even burning it off. Some people will burn them off. They don't want us to do that. The goal is to keep the tick intact and to remove it as quickly as possible, because disturbing an engorged tick can actually force the parasite's digestive fluids back into your bloodstream. And it's those fluids that can cause the bacteria that cause Lyme disease. This slide, save that tick. So we want to avoid ticks, but in this case, we might want to think about saving it. You can dispose of the tick. A lot of people flush it down the toilet, or you could put it in a sealed container. I recommend maybe taking a picture of it before disposing when you find one that's actually attached to your person. That way you can identify it potentially. Since identifying ticks can be tricky, I also recommend there's a great resource called Tick Encounters. I included that link here. It's tickencounter.org. You can submit a photo of your tick and they'll identify it for you and let you know if it is a risky tick. So another nice thing about that is it's a free service. And that is it. Does anybody have any questions for any of us presenters? I don't hear anyone, or I don't see any hands raised. And I also checked in the chat and I don't see any questions there.
It all looks good to me as well. Chanda, I just want to mention a little anecdote here that I visited my mother last week downstate around Mason, Michigan, and in that process, walked in, her dog hopped up on my lap. I started petting the dog and instantly found 3 ticks on it. So this was just last week. So that it's definitely an uptick year for them. Not to use the word tick too many times here, but yeah, just got to be aware of it. I then went on to Pittsburgh and visited my daughter, and then on the way back stopped and visited my mom again and found 3 more ticks on the dog when I stopped to visit her, and as well as 3 ticks on my mother. Yes. So yeah, it's definitely a bumper crop year this year. So.
Yeah, and it's just going to get worse. I hate to say that. But we've seen an insurgence, and I just wanted to really raise awareness. I live out in the woods. And so this is something that, I have grandkids, and, we want to really make sure that we're also looking at our kids who, they're playing outside. When I was a kid, I ran through the woods. I grew up in the woods, and I never even gave it a thought. But it's definitely something to be more aware of today. And I included some of those gruesome pictures there just to show, our kids are at risk, and like you said, our elderly parents, because you don't feel them bite you, and you don't often feel them when they're on your person either. So it's just something to be aware of.
The odd thing is I feel them on me right now, and I know there aren't any, but you're absolutely right. They like anesthetize you when they bite you, so you don't feel that part of it. And then, they're climbing on it. We've seen ticks at our hunting camp over the years, and it's increased over and over and over years here now. And it's always common to come in and do a tick check when you're out, doing stuff, especially in long grass or something like that. It's definitely. We come in and you do a tick check, take your clothes off, turn them inside out, look for ticks inside your clothes, outside your clothes. It's quite a process when we're over there, but it takes a few minutes and it's worthwhile this time.
Shanda, I just wanted to mention that we grew up in Wisconsin, and Wisconsin is well known for high incident of deer ticks, and especially for many people, having the test for Lyme disease. And my father was a farmer all his life, got Lyme disease, thought it was just arthritis, and it had significant health issues because it can cause neuropathy once it goes into other stages. So important to be aware of Lyme disease and to be able to get the medication, but also the tighter the test for it too.
I have a question for the group. This is Clarice. Great information, guys, for all the subjects. Really appreciate it. Andrew, you had mentioned about going to the ER versus urgent care. For those people who don't really want to, or who are trying to figure out, is this a bad enough break to go to the ER? You said minor fractures, or severe fractures, you should go to the ER. But what kind of fractures are you okay if you go to the urgent care? I just want to mention that because children may be different, of course, than older adults. And the same goes for emergency burns. If you could just give me an example, or give the group an example of a burn that needs to be addressed by the hospital rather than urgent care. Thanks.
I think I might defer to the experts that are the other three that have medical stuff, but if one of them wants to chime in on what the difference would be.
So I'd be happy to speak to that a little bit. So as far as burns go, I would say urgent care, if it's something along the lines of like maybe a sunburn, or something that, a burn, that burns are usually categorized, in stages, and then also surface area. So if you have a burn that is kind of localized and small, like maybe a burn on your finger or something, but if you have a burn over a large area, you definitely want to go to the emergency department. And any burn that is, significant in size, like maybe, I would say taking up like the top of your hand or something that is weeping or blistered, you should probably go to the emergency department for that. Breaks, now, I will say that's pretty tricky when you come to a fracture or a break, because I've even known of people that go in and they think they just have something sprained, and it turns out that they have a break. So that I would think for most of our clients out there, I would think that if you suspect a break and it's hurting pretty bad, might want to go to the emergency room. Um, I mean, I'm not a ER nurse, but I would think that it's really hard to tell people when to distinguish between like a minor fracture. You know, if it's something with your toe or your finger, you know, a lot of times people don't even realize that they're broken. And if it is your toe, a lot of times there's nothing they can do about it anyways. So I think you would have to look at other symptoms associated with it. So if you have intense pain or you can't walk or move an extremity, I would say go to the emergency room. What do you think, Alyssa? I see you nodding. Anything to add?
I was just agreeing that, yeah, if there's like other symptoms like the intense pain, like excruciating, the ED would be my first choice.
Well,
Did that
thank you.
answer your question?
Yes, and actually that concurs with, you know, a lot of the information I've always taught CPR and first aid. And I just wanted to point out to those people who are working with people that don't communicate very well, or you yourself don't communicate well, your family, because what you said about the breaks, people may not even look like that if they've fallen just on their rear end on the grass. And if it's an elderly person or a person with a fragile bones, and that could be any age or any person with some different disorders, they're not even gonna, they might wince until you figure out that this person's not transferring very well. I remember at least 3 times in the last 10, 15 years of persons who had that going on, and the care staff didn't even know until they tried to move this person. And so then there was, why didn't you do this? So I just want people to be a little extra vigilant in regards to breaks. And again, thank you for the information regarding the burns as well. Thanks, guys.
Oh, Clarice, that's really something good that you mentioned when you're talking about caring for people. You know, if you have clients that maybe are nonverbal or they are IDD, you know, if they have intellectual disabilities or developmental disabilities, they have a hard time maybe expressing things too. And what you said really made me think about, we had a patient one time, and I remember this patient was bedbound, and we would transfer this patient with a lift. And as it turned out, the patient was injured, and we had no idea that they actually had fractured their back, and it was caused, it was basically a spontaneous fracture, and it was caused by lowering this person on the commode. And it was a gentle lowering. I mean, and we weren't even concerned. But when you have people that are immobile, they become at a much greater risk for fractures. And so that is something to really be vigilant about. We have to handle them with a lot of care because, like I said, even transferring them with a lift can cause breaks. It's scary.
I would add that, you know, like if you call your after hours number for your pediatrician or your primary care, they can give you guidance of, like, they know you, they know your underlying conditions, and they will recommend where you should go. And I will say for kids under 5, usually they're going to say the ER because there are a lot of complicating factors to kids under 5. I know when my kid touched the 400-degree oven, I took him to the urgent care and they told me that I should have went to the ER, but they were able to do that. And the reason being is that they can't administer pain stuff and certain things in the urgent care for kids that young. So that was a lesson for me that when you're talking about young kids, everything is different. So had I called the pediatrician, I probably would have went to the more appropriate place. Luckily, it wasn't as bad, so we were able to get the care where we were at. but it's hard in those moments to think. So trying to remind yourself or put a thing like call the doctor first, because they probably would have said go to specific where they wanted it. Any other questions, comments?
I see a thank you there. So I'm not sure how this ends. This is my first time participating with this. But I'll say, thank you for the opportunity to allow me to share and for all of us to share today.